Is working as a nurse anything like Grey's Anatomy shows? And my answer to that is no, but yes. No in the sense is that no doctor has ever ambulated my patient ever, but yes in the fact that I have stories. Night shift and day shift nursing should not even be considered the same job because what you have to do is so different. And I can say that as someone that has worked both day and night shift, but also the people that you're around are very different. I find that way more type A people work day shift, way more type B people work night shift. Day shift management's there, people are micromanaging, and night shift is the wild, wild west. I was a teeny tiny baby nurse and some crap went down at the hospital I was at. So one of the doctors, male, and one of the nurses, female, were married. And I can make a whole separate video on how I think this should never happen, but it happens so much in the healthcare field, which I kind of get because the only people that know what you go through at work are the people at work. And if work is a big part of your life, anyways, I just don't think it should be allowed. Both the husband and wife were really nice, well liked. So really there were no complaints, no problems. Now they would usually take their break together, but if I worked with my husband, I would take my break with him too. No one really saw this as a problem. Till the wife nurse made friends with another nurse. She had lots of friends, but this friend and her always insisted on taking their break together, which is normally okay at night as long as things aren't too crazy and you have enough people in the unit. Now me personally, I like to take my breaks alone, eat my food alone, because every time I try to go on my lunch break with another nurse, I'd walk over to where they were taking care of their patient, and next thing you know, I'm spending my 30-minute break doing CPR on their patient. I could never go get a friend and then be like, oh yeah, I'm having a great night, I can go on break now. I guess I was bad luck, because it was always a war zone, and I learned it was just better if I just went on my break, ate my food, and went back to my patient. But I guess these two women always had easier patients. All I know is they went on lunch together. But remember, the one nurse is married to a physician that was also there at work. So they weren't taking their lunch in the normal break places. They were in the physician's lounges or I don't know, wherever he was. Which again, do I find it a little strange? You always want to take your friend to have your little lunch date with your husband? Sure, I guess. But remember, I was bad luck, so my patients were always trying to die or something. I don't know. I personally didn't have time to be worried about or even notice who was eating lunch with who. One thing I find very true about Grey's Anatomy at every hospital that I've worked at is there are no secrets. Everyone is talking about everyone. When you work in healthcare, you usually know way too much about your coworkers, especially on night shift. So I had heard things, but when this really became the talk of the ICU is when their breaks were getting longer and longer and no one could ever find them. Until one day somebody did, and that poor person is probably scarred for life. And so we don't tick off TikTok. All we're gonna say is they no longer had their scrubs on. This other person found the three of them. And no, nothing crazy happened. There was no big announcement. But like I said, everyone knows everyone's business down there. So even though people didn't know, everyone knew after this. And besides, we're all grown. You do whatever you want to do on your lunch break. As long as it doesn't affect me or a patient, I don't care. And I think that's pretty much the attitude that most people had about it. And everyone else probably would have just stayed out of their business. However, allegedly, the married husband and the unmarried nurse were still taking their breaks together on nights that the wife nurse wasn't working. And instead of just going to therapy with her husband and maybe reassessing their marriage like normal people, she decided to tell a group of our coworkers about it. The wife nurse, that is. Apparently, she was acting like she was cool with it, but also talking negatively about the nurse that was hanging out with her husband. Telling this to your coworkers was already probably too far for some people, depending on what your relationship with your coworkers is, I guess. But where they really decided she crossed the line is when this nurse pulled out her phone and showed a little home video of her nurse friend giving her husband the Glock 5000 while she watched. As you can imagine, this made some people very uncomfortable. One coworker in particular who decided to take it up to management. But here's the thing, guys. That doctor was a really good doctor. So while he couldn't really be punished, not to mention everything happened when people were clocked out, allegedly. However, someone was fired. The wife. If you ask anyone with a management role, it was said something along the lines of she showed corn materials at work. But if you asked any of the coworkers that had heard the gossip, the 411, the T, the doctor's boss went to him and said, they both can't work here. You pick. You picked his wife to get that. Allegedly. If you watched this far, thank you so much for watching. Let me know the craziest thing that happened at your hospital or your job. This is probably child's play to some things y'all know. I want to hear them. Bye.